Seen the list? And? Anybody interesting on it?
What's happening?
Some guy from Berlin. Oh, yeah, no. Henning. You're kidding.
Henning?
Mm-hmm.
Which Henning?
singulotomies on 61 patients. 10 of these operations have been for pain. and we have been able to confirm the findings of Foltz and White that singulotomy is of value in controlling otherwise intractable pain. 75 of these operations have been done for mental illness, primarily those conditions characterized by profound and chronic disorders of affect.
We're good to go, Doctor.
What is this? What is this?
Pretty much what you gassed, Aiden. We did swap your things. Dose your beer, and pay your coworkers to call you a different name. A sick fucking experiment.
I really like your record. Isn't it fun?
Stop! 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 Please! Stop! You're gonna break your watch.
Be a long night, everybody.
The first thing they do is prepare Richard's damaged hands for amputation. His nerves and blood vessels need to be carefully preserved.
Let me have the knife. Okay.
The same is done to the vessels in the donor arm.
Don't throw any of those veins away, okay? Save the veins as though they're going to work.
Once his hands are off, there is no going back.
The donor arm came off at 5:30, so we're 5.5 hours now. So we want to try to get some blood into it.
Very carefully, the new hands are attached, vessel by vessel, nerve by nerve.
When learning to stage pressure injuries or pressure ulcers, it's very important to be able to discern the level of tissue destruction that's involved. So what I like to use to give a visual representation are grapefruits. So if we start with a stage 1 pressure injury, we know that the skin is still intact, but it will present with an erythema or a redness that is non-blanchable. Meaning, if I press on this, you will not see that area and then reperfuse, meaning it'll turn white and then reperfuse red again. The trick with this, however, is in patients with non-Caucasian skin, what we need to look for is subtle changes in their natural skin tone. We will see what's called a dyschromia, or a darkening of their skin tone. So don't be fooled looking for erythema in darker complected patients. But again, a stage 1 is intact skin with non-blanchable erythema or a dyschromia.
disrupted the skin barrier function. You can see as represented here that the tissue, which is supposed to be epidermis, has now been removed. We've used the zester. But basically what you can see is what would be the papillary layer of the dermis. So this is still considered a partial thickness injury because it has partially invaded the skin, but it's only removed or invaded the epidermis and that first layer of the dermis, the papillary layer. Stage 3 and even a stage 4 or deep tissue injury, we are now talking about full thickness pressure injuries, again because of involved. So in a stage 3, you can quickly see the difference from how the stage 2 presented. Here we have full involvement of the epidermis, but now we have invaded both the papillary and the reticular layer of the dermis into, but not through, the subcutaneous tissue layer, as represented here by this fibrous tissue of the grapefruit. So again, this is a full thickness injury because it has fully invaded the epidermis and the dermis, gone into deeper tissue structures.
Tissue structures such as this representation, this is very similar to how a stage 4 pressure injury will present. And what you can see again is you have epidermal involvement, also the papillary and the reticular layer of the dermis. We have gone through and extended past the subcutaneous tissue, and now we are in deep tissue structures. This could be muscle, bone, tendon, ligament, even metal if patients have had surgery. So this is a very deep injury. This is something that needs to be readily addressed, and we need to protect these tissues to keep them.
with pressure injuries is the elusive deep tissue injury. And again, what you will see when these first evolve is intact skin, but it will present with a purple or a dark purple-red discoloration of that tissue. But even though it won't blanch, what you will note, which is different, is the tissue consistency. So it's very important not just to rely on your visual assessment skills for injuries, but to palpate those tissues too, because with deep tissue injury, you will often feel extensive tissue consistency changes. It could be cooler, warmer, it could be foggy, it could be hard. It's not going to feel like normal tissue. And with pressure injury, the pathophysiology, we have to remember, happens down at the bony tissue interface. When perfusion is not allowed to deliver oxygen and nutrients to those structures, muscle, tendon, bone, all of those things die relatively quickly. They necrose. So these are actually myocutaneous infarctions. And the skin tends to be the last thing that tends to become involved. The skin has the highest resistance to hypoxia. So it's very important to be able to recognize the level of tissue involvement so you can add it, 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 add it.
In the U.S., a rare disease is defined as a health condition affecting 200,000 people or less. Although any one rare disease may not affect many people, taken all together, rare diseases are not rare. 300 million people worldwide live with a rare disease. 1 in 2 Americans has a rare disease, and about half of them are children. Of the more than 6,800 rare diseases that have been identified, 72% are genetic. 70% of rare genetic disorders start in childhood. A genetic disorder is caused by a change in a gene or group of genes which are present from birth. Examples include cystic fibrosis and Duchenne muscular dystrophy, among many others.
Some of the biggest challenges faced by someone with a rare disease are misdiagnosis, treatment inequity, and isolation. The search for the underlying diagnosis can be a long journey and is often referred to as the diagnostic odyssey. It can take many years, involve multiple medical specialists and tests to reach a diagnosis. In some cases, delays in identifying the cause of your health condition may impact future treatments. In addition, people with a rare disease face inequities in their access to care, the opportunity to participate in research studies and treatment options. And some individuals experience isolation in having a rare disease, with geographic isolation from others with the same disease and feelings of isolation within their communities. Nor's motto is alone we are rare. Together we are strong.
Together we are strong. Together we are strong. Together we are strong. Together we are strong. Strong, 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 strong.
is a simple procedure with low risk of complication. You'll be under for about 3 hours and you won't feel a thing. When you wake up, we'll talk about it then. Do you have any questions?
No, I'm okay, thank you.
Good.
And I'm just gonna lower you down a little bit so you're lying flat. This is the oxygen. So I'm gonna need you to count down from 10. Breathe.
10, 9.
Yeah, just breathe.
8, 7.
Keep breathing.
6.
That's good.
5.
Just relax.
4.
Relax.
3. 2. 1.
There will be copious pus, first putrid, then wholesome, and mayhap fits of the spleen. But that will be all to the good. A purging of the malignancy will follow. This is brass. Come.
When will he wake up?
Today, tomorrow, maybe never.
Run, get a doctor.
I don't want people dying in my house.
Do as I say, woman!
paraffin. Put paraffin.
She's having.
Fetal alcohol syndrome is 100% preventable. Prevent it together, because a pregnant woman never drinks alone.
We're looking at a rectovestibular fistula, which is one of the most common malformations that we see in females. Here, the rectum opens in the posterior aspect of the vagina called the vestibule. In this malformation, the anterior wall of the rectum and posterior wall of the vagina share a common wall. In order to separate the two, a plane must be created. This connection is often 2 to 3 centimeters in length.
A testicular torsion can be a serious medical condition that occurs when a testicle rotates within the scrotum, twisting the structure called the spermatic cord. I remember vividly the first time I saw this in the emergency department. The poor guy was in so much pain, and looking at his testicle, you could see something wasn't right. And one thing that this patient was missing, or was absent during our physical exam, is that the patient did not have what is known as the cremasteric reflex. And this reflex is most often absent in someone that has a testicular torsion because when the spermatic cord is twisted, this compresses the nerves involved in that reflex. The twisting of the spermatic cord is such a big problem because it reduces the blood flow to the testicle. And if this is not treated quickly, could lead to necrosis and a need to remove the testicle. Treatment is almost always surgical, where they would detorse or untwist the testis and perform an orchiopexy, which is a fancy pants way of saying fixating or attaching the testis to the inside of the scrotum.